This video is made possible by our loyal Patreon supporters. Visit patreon.com.
Hello, this is Athena Jezik. Today I'm going to demonstrate to you and show you just how to set up a pregnancy massage. We have Kelsey here who is actually 8 months pregnant, so we're working on a real person who's pregnant. There's a certain way to lay them on their side, keeping the bolster high for their head so that their shoulder doesn't get squished. And there's also another bolster back here on the legs so that the legs are even. Other than that, she's laying on her side. And you work half of the body, half of the back, and then flip over and do the other half. But I'll be showing the back and the legs and an arm, and then you just flip it over and repeat it. So what we're seeing here is a little bit of a deviation here in the vertebrae. And you just want to check. Now the thing about pregnancy massage is you don't want to go much lower than right here. You want to stay off the sacrum. If you've been trained in the pregnancy work, you may have some different ways of going into that, then that's fine. But if you're not trained in this, stay away from the sacrum, especially if you're going to do any kind of heavy pressure. You can go to the hip crests and work that up into the erector muscles, but do stay away from the sacral area. So everything is fine up in the head and neck. Usually the back and upper shoulders are sore, they get tight. The pregnancy creates a lot of imbalance on just the plumb line, the center of gravity, and the whole bit. So it does have a strain on the body, as well as changing your weight out front. So I've applied some oil to the back, and I just have applied it on half of the back. And then basically it's the same kind of thing that I do for regular back massage, with a bit of changing it up a bit for accommodating the side work. And the shoulders are quite, there's a lot of tension in the shoulders. So I just start out by starting at the neck and pulling the shoulders open, which is the usual way that I begin. Let me get a little more here. Okay, there we go. Which is the usual way that I begin when people are laying on their stomach. Start up at the base of the skull, where the neck muscles connect into the skull, and just draw that line down through the upper shoulder. And you can go with a fair amount of pressure here. I'm not a real deep pressure person. I work the tissue in a different way than pushing hard on it. But if you do work deeper, you can dig in deeper. I really don't do any pregnancy massage anymore. When somebody comes into me for pregnancy work, I do Cranio-Sacral therapy. I find that seems to do the job. Plus it prepares people a little bit more for the birthing experience, both mother and the baby. So you just go down like normal along the trapezius and then come up on the shoulders, and you can move that a little bit, bringing that shoulder out so you can come under the shoulder. These are really tight shoulders. There's a lot of tension under there. So what I'm doing here is I'm just going to hold this area because the muscle feels a bit tight, and I'm just going to wait for it to release. This is where some people would kind of push harder and harder, but you want to keep a steadier pressure that's not pushing into it any further than what the body is maintaining. If it's pushing you back, then you know you're too deep in. You want to let it accept you in, and then your fingers will start sliding as it softens and opens. It's just a gentler way to do it. There's different ways of accomplishing it. I think this one holds a little bit more permanently than when you force it. Now when I go up here, the muscle is much more fluid. There's a little bump here. This is where we're crossing over probably a muscle underneath the rhomboid a little bit, but let's work to get the attachment area open. There we go. I've kind of flattened my hand out across a longer space of the muscle because the muscle is doing a lot of moving around in there, unwinding itself. It's actually fascia unwinding itself from being twisted, and now it's much smoother. So now there's not that jump in there. There's a little different because you have to define where the muscles are. Yeah, it's way different than it was. So that's changed a great deal. And then I just go along, like spreading the trapezius and getting into the rhomboids, which are underneath that, just spreading that open a little bit. It's actually kind of hard to work from the side because you have to lean sideways and all that. And it works better if you can sit down because you're a little more level with them. But yeah, that's changed quite a bit. And then now we move down the back, going to the hip. Here's the hip crest, and then here's the SI joint, and you don't want to go into here. Here's the sacrum right there. So I always just stay away from the sacrum when I'm doing the massage work, and here I'm just doing the normal kind of thing that I do in many of my videos when people are laying on their stomach, and I can feel here that there's it almost feels like there's little traumas, almost little tears going on. Now I'm getting close in, but I'm off of the sacrum. Here's the sacrum. So I'm going to curve right here and work up, and then catch into the back about at the T1 level. You just miss the low back on that for the most part, and then come back down. And then you can do it again, coming in. There you are, you're missing it, you're coming into it. There's a sacrum where my other hand is to show you not to go there. Draw up into the neck. And I usually do things 3 times, so here we go again, up we go. There's the sacrum. I'm not putting any pressure there, I'm just holding it so you can see. And up we go. And of course, I'm stretching quite a bit because of the camera angles, but you can slide your chair, and that way it'll be a little bit easier to do. Now here you can do the thumbs on the hip, but again, you don't want to go into the spine right here. And then as you get farther away from the sacrum, then you can go into that low back. You just want to stay away from the sacral area. It's more of a precaution. There are ways you can work into it, but it's just better if you don't really know and understand the body and what you're doing, it's better to just not mess with it. Because if the pressure is too deep on something like that, you can cause some problems. And there we go. Then we can knead a little bit through this. We can also knead it, which is actually almost more of a petrissage, but up we go, and then back down. Okay, so that's really about all you can do on the back. Check the shoulders, and that's still pretty good. It's pretty soft in there. Softer than it was when we started. Okay, so now we can go to the arm, excuse me. Now we're moving over to the arm. So when you do this, it's a real different order that you do when you're working from the side. And sometimes if people have had maybe stomach surgery or something like that, and they need to lay on their side, you can do this. It doesn't have to always be for pregnancy. It can also be for some other thing. So you start with the back, and it's the half of the back, and then you go to that arm that's up on top, and apply a little bit of oil. This is scent-free. And get that really good. And then you can kind of tie the shoulder in too with the back work that you just did. And just go over that, where this rotator cuff area, and get into the top part of the scapula because we worked more underneath it before. And then you come back up, working through the deltoid. There's no real areas that you need to avoid. There's areas to be careful of where the nerves are running, but it's not like the back and the sacrum. And then just go up the bicep, opening the arms. It's just basic arm work. And here's more tight muscles. Yeah, that's good. Okay, and then you can get down doing a little more. You can pretty much do what you do if you're a massage person, or if you're just wanting to work on your partner. Think about what feels good and be careful of your pressure, and just work it and manipulate it, always making the harder pressure go toward the heart. And then down into the forearm, working into those muscles here. These get kind of tight, especially from computer typing and more fine work that we do with our fingers and hands. So here we have, again, remember, it looks like my thumbs are wagging, but they're not. They're moving with the hands. This is more of a thumb wag, where the hands are still, but when you want to kind of roll your hands so the thumb closes and it doesn't really wag. If you do a lot of massage, especially this is, people that are doing this, you want to really be careful of your alignment because you do wear out the joints. And then down into the wrist and the hand, and of course this is just a typical hand work. You can also, if you need to, you can probably bend their arm a little bit and hold it up. And getting into the palm of the hand is where I'm going now with this, into the palm and the top of the hand and along the fingers. Check for articulation if you want to. And then now the back part of the arm, this inside part, there's where more nerves and veins run, so you want to be real careful. If you're going up here, that's another tender spot. Inside the elbow is another one. You just want to be a little tender with that. And then you can place the arm back, coming up. And then you can also just go back up to the neck and work a little bit here, just to tie it in a little bit, lifting the hair. And just bringing that kind of all in with the neck and shoulder, as well as the neck and arm. And because we didn't really get much of the neck, you can even come up and even work a little bit more like this on the neck, a little back and forth. Staying on the muscle, don't go too far around or you'll be getting into the throat stuff. And this is a little catch point. Always right here, this is that levator muscle. So you might want to check and make sure that that feels like it's soft. It pulls the shoulders up and down. It's right here where it attaches and it runs up the neck. That's all soft. Your shoulder feels so much better. So you can kind of just run through the shoulder after you do the arm, and the shoulder can get a little bit two times getting attention Okay, so getting into the scapula, up into the neck here, the levator muscle. And then if you want to, you can even go a little bit more and just work up into the head, into the scalp. But again, now when you do this, you want to, it's hard to explain, but you don't want to just rub your fingers across and making the hair follicles move. You actually want to move the skin, because there's a little tiny layer of something there that you want to wiggle around, and it's the skin and a little layer of fat and probably a little bit of a muscle, not much, but it's something that can move around other than just the hair follicles. You know, I work with the head all the time. It's basically just the skull, and I always feel the skull bones moving, but there is this skin that likes to move across it because it feels so much better. It's not really like washing your hair, which feels good too, but on a massage, you want to work that scalp so it's not just this kind of thing, like itching. It's more of a moving of the skin layer and anything underneath it, and you can go around on that. And you don't want to push too hard on the head either. You just want to connect it in like little Velcro and then scoot it in little circles. And think of a line. You can also go and do a little bit on the ear if you like. And even behind the ear. But be careful here because there is muscle, but there's also other things. So you can just very gently, and even into the occipital base and the upper part of the neck as well. You can just add that because, this work doesn't take that long, just the position of it all. So you can take your time and get a little more detailed with different things. So you can do that, come around and lengthen and just pull up, and that should do it. So next we can show you the legs. Thank you so much for watching. I hope you got some information out of this to help you with your clients or your friends, and I look forward to seeing you in the next video.
Many of our subscribers don't see our videos. Make sure that you click the notification bell.
Introducing Yoga Plus, offering a free series every month with over 300 different videos. Take control of your health. Work out anytime, anywhere. Yoga Plus. Download now for free.